Good morning on this Friday, and thanks for joining us here for Live Impact News on 13 News Now Plus. We got quite a bit to talk about this morning and some things we are waiting to get started. Hopefully you have had a good week and you have some good plans here for the weekend. If this is your first time joining us either on 13 News Now Plus or if you're watching on YouTube, of course, we appreciate it. We're located right here in Hampton Roads, Virginia, but we'll be covering topics that impact not only our region but across the country. My name is Eugene Daniel, and in our studio right now, I'll give you a quick shot. This is producer Nia Campbell. I don't think you can see her. There she is, producer Nia Campbell, and we have reporter Alex Littlehales, who's going to get us started here this morning with a very important conversation that is taking place right here in Virginia. There are efforts right now to protect rural hospitals in the Commonwealth, this particularly coming after cuts through the big, beautiful bill, as it was referred to, it was signed into law not too long ago. And Alex, it's my understanding there have been recent efforts now that have been made to protect these rural hospitals who could stand to be in jeopardy under these cuts.
This is a very layered and complex story, so I guess I will try to go through it as, as clear cited as I can, but there's just a lot of moving parts in this because it deals with state and federal policies and everything that is going on with the Trump administration right now. And it deals with, essentially one of the biggest talking points in politics right now, which is sort of the future of Medicaid, the Affordable Care Act, ACA extensions and subsidies. So this is within that realm. So the headline that you just described is where we'll start, I guess. So last week, the state of Virginia, including the Secretary of Health and the Youngkin administration, submitted an application. It was a request for $1 billion, B with a B, billion with a B, $1 billion in federal funding requested from what is called the Rural Health Care Fund, or the Rural Health Care Program, whatever you want to call it, but it's the same program. So essentially what Virginia is asking the federal government is to invest in essentially $1 billion that would specifically go towards efforts that would upgrade and improve healthcare systems and operations in specifically rural communities in Virginia. And so why this is important is because the application for this was last week during actually the statewide elections. And so it was announced very late Friday that Virginia had actually, sent in this application to the federal government. And the background and the context for why this is important is because this Rural Healthcare Fund was stood up and created essentially following and is a part of the, as you had mentioned, the One Big Beautiful Bill. It is a part of the funding structure in Trump's spending bill. And so what you have to understand about this story is Virginia is not the only state that's going to be applying for this, and Virginia is not the only state that is, going through this process of trying to get this kind of federal grant money. What is happening, though, is that because of the anticipated cuts to Medicaid and the Affordable Care Act over the next 10 years, some of the estimates are $1 trillion in cuts to Medicaid over the next 10 years, millions of Americans basically losing their insurance within that time span. There have been bipartisan concerns that these Medicaid cuts would also affect rural communities and their ability to operate, specifically because if you cut Medicaid from a certain demographic or a population, you have a risk of a hospital or a health system having a lot of uncompensated care. And so when you have an area or a hospital that has an uncompensated care because of all these cuts, then that facility essentially faces risk of closing because they can't operate because of the cuts. So essentially what is going on is that Medicaid cuts are part of the Trump spending bill. but there have been bipartisan issues on both sides concerned about what that would mean for rural communities. And in response, the same funding bill has said, okay, well, we're going to have this $50 billion rural health care fund that states can tap into. And so what we're seeing now is that states have had the November 5th deadline to apply. And so we now see what Virginia's application looks like, what's being requested, what the funding would potentially go towards. But I think before we move on, it is worth noting that the federal fund is $50 billion, okay? That's important to note because that is essentially the pool of money that everyone is trying to tap into. And there's a lot of details about how exactly the money would be dispersed if a state is approved, and so I won't get into sort of the X's and O's of that because it's a little boring. But essentially what you have to know is that there's $50 billion of federally accessible funds for states to attack rural health care upgrades. What has also been a concern is that $50 billion is essentially 1/3 of the cuts that the Medicaid cuts are expecting to impact to rural communities. If you see what I'm saying? So basically, they're saying that this rural health care fund that states can dip into, it is only essentially 33% of the ultimate cuts to rural communities because of Medicaid spending over the next decade. So there's definitely a lot of push and pull, a lot of there's just a lot of push and pull in a very dynamic and still very fluid moving situation.
Now, you spoke with a few people and you interviewed some folks who shared their concerns. What are they saying?
So I'm actually working on, this is a smaller portion of a larger piece that I'm working on related to the kind of concept of the risk of rural health care for people who rely on rural health care in their daily lives, right? And so the larger piece that I have been working on is just talking to people specifically in the city of Franklin and Southampton County communities, because there they have a hospital called Southampton Medical Center, which we just played a little bit of video of. That hospital was identified as one of 6 hospitals in Virginia that could potentially close. They're not saying it's for certain, and they're not saying that people need to start making plans. But what they're saying is, based off of the sort of the funding structure and some of the financials around this specific facility, this is a hospital that is that could potentially be at risk for closing at some point in the future if the Medicaid cuts move forward. And so what I have been doing is talking with folks in the city of Franklin and Southampton County communities, just asking them, how would this affect your life, right? How does this impact your ability to, what is the kind of emotions behind losing your only hospital and the next closest one being like 45 minutes away, right? Because that's what some of these people are risking, right? You're risking, or you run the risk of, because you're in a small community, that you don't have access to a plethora of medical options that are close by and maybe more urban centers like Norfolk, Virginia Beach. So I was just really curious to see what do people think about this and the impacts it has. And so one of the people I talked to for this story was actually a diabetes clinician in Franklin. And she's essentially the only, she's one of the very few clinicians of this kind in that area, right? And so what we talked about was the concepts of chronic diseases and how that impacts rural communities much more frequently than it does more urban centers potentially, and how there's a lack of resources to begin with. But that's essentially who we have spoken with. And so I got her thoughts on essentially how, could this impact your life, not just your life and your business and your medical facility, but how could it also impact the people that you are trusted to care for and serve in an already vulnerable, from a medically speaking standpoint, a vulnerable population.
Well, let's go ahead and listen to her. What's her name?
Her name is Dana Stallings. She
Okay.
is a diabetes clinician, again, in the city of Franklin.
Okay, let's give her a listen.
Clinic owner I'm not able to help my patients if they can't come in the door and pay for their health care. And so then rates of diabetes and other chronic health conditions skyrocket even more because they're not getting their, what do you call it? They're not getting their health care. Mm-hmm. But then also that is a potential funding stressor for a clinic like mine that's private. I don't get external funding. So if my patients can't come and we can't bill health insurance for their appointments, then our revenue goes down, and then that puts our business at risk of, not being sustainable.
So certainly interesting, Alex, to hear from her in that standpoint and her kind of concerns and predictions with all of this. Mm-hmm. I'm sure there are a lot of people, as you said, who look to these hospitals mm-hmm. as their saving grace when it comes to their health, and to hear from them and say, hey, this is what could happen, but still that went through.
Yeah, I mean, this is it's certainly an interesting and I would say it's pretty scary for these folks. I've talked to them, and so I've just had open and honest conversations with people in that community. And so the stories, primarily, not to show my entire hand, but of the project I'm working on, there are some quite compelling stories. One of which that I'll go into is a woman who was diagnosed with leukemia, actually suddenly, just a couple months ago, and she credits this hospital, Southampton Medical, as essentially saving her life, because she said, had the hospital not been so close and so accessible, she may not have taken the time and the energy with her 2 kids to drive 45 minutes away to the next closest hospital, which is in Suffolk. So it's about a 40-minute drive. There's another hospital that's 36 miles the opposite direction. So again, it's and there's also no urgent care in a lot of these communities, right? I mean, sometimes the only medical facility that you have is either a specialist and or the emergency room or a hospital, but there isn't necessarily, at least in Franklin, so I can't speak for every community that may be dealing with this, there may not be an urgent care as well. So the stories that I heard was, that's one, and that's what I'm actually basing my story around, is this woman who essentially was diagnosed with leukemia as an adult, and she's in treatment now. She's going through chemotherapy, but she quite literally credits the hospital for saving her life, because had it not been there, had it not been as accessible to her, who knows if she, in her words, who knows if she would have taken the time to get some of the symptoms she was experiencing checked out. And the thought of that access and the thought of that possibility and that resource,
it would be scary for anybody.
Being in mm-hmm. jeopardy is, I think, something that, regardless of who you have, your political leanings, I mean, that is something that is objectively scary to think about, right? Yeah. I mean, and it's part of the larger conversation about how, I live in Norfolk, so I don't really think about it, right? I don't really, I know that I have medical access, or I have access to medical care of some degree in several different ways within minutes of my house.
Yeah.
And the fact that there are some people that you forget maybe only rely on this one place potentially.
Yeah.
There's another woman that is part of the story that she actually had a heart attack in the middle of the day, and so she actually drove herself while experiencing this heart attack to Southampton Medical. And so, similar story, had the hospital not been there, what would my day have looked like? I mean, what would I even be standing here right now? And so, none of this is to say that, and I'm trying to make a very clear in my story and my my reporting, that the hospitals aren't like at risk of closing tomorrow. They're not. This is not a situation
I'm glad you
where,
said that.
And this is not a situation where the funding structure from the spending bill goes into effect, and then all of a sudden we have a couple within months these hospitals just upend and are out of these communities, right? The point of the story, though, is to highlight that there are hospitals that have been identified that financially they could be in trouble if the Medicaid cuts move forward in the way in which they have been so far written. And even though it's unclear when and how those effects could be felt, that uncertainty in and of itself is a concern for these folks. And so the point of the reporting is to say, hey, this is something that rural communities in Virginia need to be on the lookout for, but it's also exactly why, the state has applied to tap into this rural hospital fund that other states are going to be doing as well.
All right. So I know we only have you for a few more moments here, but I know you have another soundbite here from the woman that you interviewed, and you wanted to kind of bring that in as well.
Yeah.
What's the cue for the next one?
Well, I think it's just as someone who lives in that community, it is Dana Stallings again, just explaining, the mentality around healthcare in a rural, tight-knit community like they have in Franklin and Southampton County.
In rural healthcare, there's already kind of an attitude of, there's already an understanding that we're underserved as it is. And so many patients do not seek the healthcare that they already have available to them because there's simply a culture out here of it is what it is. And, it permeates the family tree. And so we are already underserved. And even though it's going to make a massive impact, there's going to be a certain amount of residents who it will be a gradual transition because they either don't seek the services as it is already, or they kind of have already prepared themselves.
All right, so you heard that portion there, Alex, and I know you had some other things you wanted to kind of lay down.
Yeah, I mean, the whole reason we're talking about this is because the headline is that Virginia has applied for funding to potentially fix this shortfall, right? And so, unfortunately, we do not have, it has not been made publicly accessible yet, the actual application itself. What I do have are a couple of sort of summarized takeaways through the Department of Health about what the application is. So what we know is that of the $1 billion, there are 4 categories in which rural healthcare is looking to be upgraded here in the state of Virginia. First, the slice of the pie that is the most is essentially $400 million that would go towards essentially expanding access of mobile and telehealth care across rural communities. It is sort of $400 million in that space, right, of kind of preventative care rather than reactionary, right? $280 million would go towards essentially upgrading technology to better support the systems in those rural communities. $132 million would go towards retaining of essentially staff and making sure that rural communities had qualified staffing and quality residents from a medical standpoint that are there caring for these communities. So it's essentially incentivizing monetarily medical professionals to stay in these rural communities. And then another $120 million towards things like food as medicine, active kids, just kind of more preventative care initiatives that essentially, yes, maybe the money doesn't go specifically, it's not a lump sum to a hospital, but it is money invested in rural communities that could potentially, offset some of the financial losses that the facilities themselves may be experiencing. So it is unclear, though, to be fair. It is unclear if this money goes, how the hospitals could actually utilize them, or if it just kind of bolsters the support system around these hospitals. That, again, is unclear from what we have publicly available, but yeah.
Now, Alex, I mean, a lot of information there. Again, it's very important to a lot of people who particularly live in these communities where if you live in a larger kind of metropolitan area, you don't understand how difficult it can be if you're not near things like a hospital in reach, right? Because every second counts when you're having some form of medical emergency. And I think that's what we're hearing from these people and why they're so concerned if their hospital gets to the point where they can't really function the way they want to. But for those who want to watch this piece, when is it airing, and then how can they get it?
It will be, it is still in So there will be some reporting more. You'll hear more from Dana Stallings on a report that I'm filing tonight. Again, it is kind of recapping, again, more the actual application that has been submitted from Virginia, the actual stories, the perspectives of the people that live in that community that I'm kind of compiling for this composite story. That is still being edited, and probably in the next. I actually don't have a firm. As it works. I don't have a firm definitive date of when it will air. It is essentially something that could run next week. It could also run during Thanksgiving, as you know, is a time when a lot of reporting staffing, goes home for the holidays. So it could be used to bolster some of the shows then. Not entirely sure, but I know that it's in a vacuum, in an ideal world, it should be in the next 1 to 2 weeks. And I think it's some really powerful storytelling there. So.
All right, Alex, man, appreciate you, man, breaking all that down. I've been looking forward to that story, still looking forward to it, because we had talked about it when it originally was a concern raised several months ago with that bill, and you said it. There were people on both sides of the aisles who were saying that there was concern about what this would mean for those who were in those rural communities here in Virginia. So this is something, no matter what, there's concern.
The whole story, stems from Senator Mark Warner actually visiting that area and having a roundtable with folks that are frankly upset about what they think may happen. Yeah. So.
Okay, man. Well, I appreciate it, man. Alex Littlehales, we'll look forward to that story coming out. I'm sure the people in those communities, too, here in Virginia are appreciative for you giving them a voice and going down as well. Okay, right now we're waiting for our next guest to log on in here for a very important conversation. This is going to be about those healthcare tax credits and what happens if they do not extend. But right now we're going to go to Charlotte, North Carolina, where there are several elected officials there in the community who are speaking their concerns about ICE activity and Border Patrol in their area. They've been going now for more than 30 minutes or so. So we'll see what is being stated right now, see if they are still going while we get the next guest situated. But this is coming out of Charlotte, North Carolina, where several elected officials have been speaking their concerns, again, about ICE activity there in that city of North Carolina.
Nuestras pólizas y hemos dado trainings varias veces. Tuvimos un training en el verano y entonces lo que podemos hacer es controlar lo que podemos controlar y en nuestras escuelas los estudiantes sí están seguros.
I just had a question for some of our state representatives or state senators. Have you been in communication with Governor Stein about the CBP's visit at all? And why Charlotte? Why do you think they chose Charlotte?
So I'll answer the first question last. Oh, sorry, that's right. I'll answer the first question last. I think that they're choosing Charlotte because it's a part of a bigger playbook. When you look at the fact that they're going to democratically led cities, unfortunately, a lot of times the mayors happen to be black. When you look at Los Angeles, when you look at DC, you look at Chicago, all those places, right? I mean, that's a part of a playbook. There's nothing happening here. And in fact, our population just really doesn't demand that, right? I have been in touch with the governor's office. And so I know that I saw, at least from the Charlotte Observer, that of course they reached out to the White House and did not get a response back from them. So, this has just not been a transparent process overall. And none of us stand for it.
I have a question for Hector Vaca, if I could. I wanted to ask, just since you said that you had experience before with Border Patrol and with ICE, what kind of advice would you offer to immigrant families right now, especially those who have mixed legal status, and what would you tell families to do or not do if they see CBP agents?
My biggest advice to anybody who's caught in a similar situation, who's caught in a situation where they're being interrogated by CBP, ICE, or any other law enforcement agency, is stay calm. Because when you show confidence, they will back off, which is what I did when I was confronted like that. I just showed confidence and told the truth. So that's the biggest advice I can give people. Be confident, stay calm, and assert your rights. Let them know what your rights are. that you also are exercising your right to remain silent, and that you're exercising and continue asking them, am I free to go? Am I free to go? Because if it's not a real arrest, they're supposed to let you go. So confidence and just know what your rights are. Oh, okay, thank you.
I'm sorry, say that again. Oh, Mark Terrell, they got a question for you.
Oh, they had a question. So, yeah.
I mean, what is the county doing to prepare for this? And, you know, what have you heard as to why Mecklenburg County is if you don't mind speaking about it?
Yeah, sure. So a couple of things. We don't have any, excuse me, we don't have any information. This isn't a request that came from Mecklenburg County for assistance or for help. And so we don't understand what the plan is, what the strategy is. Typically, the way we like to operate, which might be a little strange to people, but we like to understand what the plan is, right? What is the strategy? What are we trying to accomplish? And so that usually takes a two-way process of communication, which we have not had. As a matter of fact, everything has been veiled in this cloak of secrecy, which, again, I don't know what we're trying to accomplish. And so what we're trying to do is educate the citizenry with respect to the information that's available, resources, community groups that can help. We've put out guidance to our staff with respect to county assets and the way we should approach it. We are not here to break the law. We are here to abide by the law, but it would be great to have some partners that were working with us to be able to make sure that we understand exactly what the plan is. Thank you.
All right. Well, thank you all. Thank you for being here.
Thank you.
Okay, just to give you a little bit of background on that real quick, this is as the Trump administration says it's going to be deploying the U.S. Border Patrol to Charlotte as part of its immigration crackdown as early as this weekend. That's why you saw all of those local leaders there in Charlotte speaking out against that. Again, we rolled on the beginning of that press conference. We may later on in the stream prior to noon to play some of the earlier conversations that were held there outside of that. That information about the Border Patrol confirmed to local outlets there in Charlotte by the Mecklenburg County Sheriff, okay? So that is what they are all rallying around at this point. They are under the understanding that the U.S. Border Patrol is coming down to Charlotte, and they are speaking out about that. You could actually hear from several of the leaders earlier in this presser saying that they do not believe it is necessary for their community, that they have those things under control as a safe community there in Charlotte, and that the presence of the Border Patrol there, they argue, is only going to incense things further there in their community in a way in which is not necessary. And so that is what is happening there at the moment. Wanted to give you a little bit of context. Again, we're going to try to come back a little bit later in the show and show you that earlier portion of that press conference so you can hear more from the state elected officials for yourself. But right now, we do want to bring on our next guest to talk about another very important conversation. Earlier, we were talking about the efforts to protect rural hospitals here within the Commonwealth as part of cuts made under the big, beautiful bill that was signed into law months ago. But right now, there's another conversation about healthcare that was the centerpiece of the longest government shutdown in American history. We're talking about those healthcare tax credits as part of the Affordable Care Act and how the fight was to extend them. They are set to expire December 31st, in which many say that it could mean a huge, huge problem for millions of people who depend upon it for their health care. Right now, joining us is Gayleen Knoyton, who is the founder and CEO of Celebrate Healthcare. And Gayleen, thank you so much for joining us to talk about this very, very important conversation that was so important. It had Democrats and Republicans shutting down the government for over 40-something days. So thank you so much for being here. Let's make sure that we can hear her real quick on her audio. Hold us 1 second, Galen. We're going to make sure that you're not muted, and on our
Can you
end
hear me
we
now?
got you. There we go. We see you. Okay, we can hear you and we
Okay.
can see you.
All right.
Oh, so Galen, let's start here. Why this matters, okay? So the tax credits under the Affordable Care Act, they're set to expire at the end of the year. For those who have been hearing that over and over again as being a key reason why Democrats and Republicans could not reach a deal for this government shutdown, can you explain, in your expertise, why does that matter?
It matters because the subsidies brings down the premiums extremely low. So therefore, if the subsidies go away, say for example, if a plan costs $1,800, and you can get a subsidy that would bring you make $30,000 a year, and your subsidy would bring you down to $26 for a bronze plan. You know, whatever that full cost of that plan is going to be is could be what you're going to pay after the subsidies go away. We don't know exactly what that's going to look like, but right now we're enrolling people and we're telling folks, don't panic and make sure that you have all of your right documentations and enroll into a plan. We still don't know what's going to happen by January 31st. But go ahead and roll into a plan right now while we still have the subsidies. And so you'll be covered.
You know, I was just looking at some data from KFF, which tracks healthcare and different things from an analysis standpoint. And it said in 2024 that those premium tax credits save subsidized enrollees an average of $705 annually in 2024. And by their estimations, if those, it says if Congress extends tax credits, subsidies enrollees would save about $1,000 over the year in 2026 on average. But if they were to expire, then they're saying that it is estimated to more than double what those enrollees who subsidize currently pay annually. A 114% increase is what they are looking at for the average person. And we know that there have already been people who have received their bills and what those premiums could look like. And that's kind of what Democrats say sparked their position in trying to hold out on striking a deal that included this. And so I'll ask you, you said we don't know what's going to happen by the end of the year. We know that a part of the deal that they reached, supposedly there's supposed to be a vote at the least. What's your hope to come out of the conversations between now and the end of this year when it comes to these tax credits?
Let me just say this. Health insurance is a right. It is not. Healthcare is a right. It is not a privilege. Let's just start right there. I'm hoping that the subsidies will extend. Now, remember, in Virginia, we are a state-run insurance program. We have the Virginia Insurance Marketplace that happened under Governor Northam. And so it happened under Governor Northam. So there's a possibility that it may not hurt as much, but it still will in Virginia. There's an opportunity that perhaps in the General Assembly session that something can be done. So we have all kinds of different options in Virginia. However, I'm hoping and praying that the subsidies will extend, into the next year and beyond. We have more people going to the doctor now. We have more young people going to the doctor. I always say it's like having a driver's license. Now you ask someone, you have a driver's license, and do you have health insurance? And many of them will tell you, yes, I have my health insurance now. Whether it's Medicaid, whether they're in the marketplace, or whatever the case might be. We have more people going to the doctor. We have more people that are taking advantage of the preventative care, of getting their annual physicals, mammograms, colonoscopy. And this saves lives. And people know that have enrolled into an insurance plan that they have either detected an early disease or it saved their lives in the long run because they had insurance. We don't want anyone to go back to the emergency room and use it as being their care, their doctor. We don't want that anymore. We want people to continue to have their insurance, have a primary care doctor, and get their preventative care annually.
And it's interesting when we talk about this because we know that not only were Democrats talking about the importance of extending and talking about these tax credits, but there have been Republicans too, including Congresswoman Jen Kiggans right here from Virginia Beach, who said, "Hey, we need to really have a conversation about what we're going to do with this because of the number of people who would potentially be impacted." So the issue was, when do you talk about it, right? So now they want to have this conversation. Hopefully they're able to reach some resolution wherever that is going to be. We will see soon. But I know Gayleen is part of Celebrate Healthcare, and then your work in the community. You've been talking with people. I do believe that you recently held a public discussion about this. What are you hearing from others who are in your field of work, and what are some of the other things that you are working on right now to either make sure people have access to health care or to be able to advocate when it comes to those who may be in a situation where they can't afford it?
We're going to stay in the community. We're going to continue on educating and enrolling people into the health insurance marketplace and the importance of having health insurance. Realize that if someone doesn't have health insurance and they go to the emergency room, and we have more people going to the emergency room, who's going to pay it? It's going to be all of us paying it back in taxes. So, therefore, having insurance saves not only a person's life, but it also saves the community from having to pay an extra in taxes for people going to the emergency room. Let's look at the bigger picture. And that's one thing we talk about. Another thing that we discuss now, I'm having stakeholder coalition meetings on the SNAP and Medicaid work requirements and paperwork. That's another issue that we have to address. SNAP work requirements, it used to be able bodied. Now it's you have to work unless you have a doctor's note. And the change and things has changed with the big, what they call the big beautiful bill. We call it something else. But if you look at SNAP, before covered you up until you were 18 years of age, and now a family that has it goes up to 14 years of age for a child, which means that both parents will require work requirements, which is 20 hours a week. That's 80 hours a month. What does that mean? What if the mother is a stay-at-home mom and the dad is working? The mother still will have to go and work. Both parents have to work. Medicaid is not going to start until January of 2027, the work requirements. However, we need to start talking about the paperwork for SNAP and for Medicaid now, because that is going to be the biggest barrier on helping these recipients complete their paperwork. Also, meeting the deadlines to submit the paperwork as well. So, as a community, whether you're a business, whether you're a nonprofit organization, a retired social worker, we're talking about bringing retired social workers together to help recipients complete paperwork. And we're also talking about having trainings to do that as well. And then also, where can someone go to get volunteer hours or meet their work requirements? It's either working or volunteer hours. So where are they going to go to do that? So we're looking at different places. We know that we partner with United Way, and United Way has a page on their website where you can, if you're a nonprofit, you can put in what volunteers you're looking for, and then then people who are SNAP or Medicaid recipients can go on that site and see where they can volunteer. We're also looking at businesses as well that are hiring, to help meet these work requirements. We want to start having these discussions now. Don't want to wait, because the SNAP recipients are already receiving letters, and some Medicaid start getting letters too. So we need to just start putting a plan in place. Um, making sure that everyone understand what the changes are. Um, Even in Medicaid, it's not going to start right away. It's going to, I said it's going to be down the road, but it used to be, it will, right now it is 3 months retroactive if you are signing on to a Medicaid plan and you had some um, health issues or went to a doctor 3 months prior, then your Medicaid will be retro. When this new Medicaid pops in January 2027, it will only be 1 month. That's 30 days. So we have to make sure everyone understands what the changes are. We're hoping that it would, that it would change, um, but um, we won't see it change till, I guess, to the next election. But right now, it's about educating everyone to, number one, don't be afraid to enroll in an affordable care plan. Um, Talk to someone. You can call Celebrate Healthcare. You can visit our website at celebratehealthcare.net. We have a navigator and trusted agents that we work with that will navigate you through the process. And so right now, it's the time to do it. You have until January 30th to enroll into a marketplace plan. And so we're going to have as many events as possible. We have an event on Friday, um, November the 21st. We're having a stakeholders meeting at 8:30 to 10 o'clock, and that's going to be at Tidewater Community College at the Portsmouth campus in the Student Center. And that's for all agencies and nonprofits and faith leaders and businesses and organizations. And then afterwards, from 11 to 2, we'll have a health insurance enrollment clinic along with health screenings, 3D mammograms, and other resources. And then on Saturday, we'll be, that's November the 22nd, from 11 a.m. to 2 p.m., we'll be over in Hampton partnering with the Do-Gooders of Hampton Roads organization at the Kenny Wallace Resource Center in Hampton, and we will be doing 3D mammogram screenings. We'll do health insurance enrollment, and also the do-gooders will be giving away Thanksgiving baskets. So you can either donate some food, or if you're in need, you can pick up a basket. So those are some of the things that we'll be doing, and we're rolling all the way through January 30th. We'll be having all kinds of events, making sure that everyone gets enrolled in a health insurance plan.
So plenty of opportunities for people to get enrolled. And I know we talked with the leader of the Virginia Marketplace just a few weeks ago as well, when they went live with that. And he said a lot of the similar things as you, Gayleen. Really the big thing, they're trying to get people to make sure that they are registered with a healthcare option, because you don't want to wait until you're sick. Right? You want to make sure that you are prepared before that happens. And so great opportunities there that you and your team are putting forth. And of course, I always appreciate you for coming on and talking about anything that has to do with this particular topic. But we know that we're going to hear a lot more about it, particularly those ACA tax credits here in the coming weeks. And of course, we'll see what they decide and maybe bring you back on at that point as well. As always, Gayleen Knoyton, Celebrate Healthcare CEO and founder. We appreciate you this morning.
Thank you. Have a good day.
All right. Have a great day. Have a great weekend, Gayleen. Thank you. Okay, like we said, that is a very important conversation. It was the center point that drove the wedge between Democrats and Republicans for 40 plus days, for the longest government shutdown in American history. And the conversation continues as we are expecting to hear some form of discussion and vote, as promised, as part of the bill that was actually passed, a continuance bill there for spending before the end of the year. Right now, I do want to turn our attention to Suffolk, where Virginia State Police are revealing information about a suspect connected to a 30-year-old cold case murder out of Gloucester County. Right now, there's a press conference going on. We've been recording on the first part of it, but we want to go in live to where they are right now.
No. All we can definitively say is that her bodies were recovered in the waters of the Elizabeth River off Granny Island.
So, General, that would have been a Norfolk case, I guess, if her body was found.
I can't speak. Yeah, I can't speak to that.
So the circumstances of her case is still a mystery. There's still many unknown things about this case,
Oh,
correct?
yes, absolutely.
And then, do we know if his DNA has been entered into CODIS, the U.S. National DNA Database?
It's prohibited from being entered into CODIS because in order for it to be entered in CODIS, you have to be convicted or arrested of certain felony offenses, and Wilmer was not.
But under the circumstances, should an exception be made because of the past history and the past connections to these horrific crimes?
I think that's something that needs to be legislated.
As I understand it, can't you do manually key checks against CODIS, against DNA?
That I don't know.
When did Wilmer become a suspect?
As soon in Lori Ann's case,
Yes.
in Lori Ann's case, as soon as the results came back with David and Robin's case.
So he had never been a suspect back in decades ago?
I can't speak to what in Lori Ann's case, specifically Lori Ann's case. No.
Is there anything to say, I mean, this person went his life without committing a felony, flew under the radar. Is there anything to say about that, the fact that he did it so well flying under the radar about this?
I don't know if it's the fact that he did so well or it's the fact that technology has improved and we're better able to identify individuals.
Has Wilmer's DNA been tested against other cold cases and they found that he's been excluded, that he didn't do that? And if so, what are those cases? Because that would be useful, I'm sure, for some family members who are kind of out there going,
I can only speak to the cases that we're involved with, and those where we have had biological, forensic biology, which means DNA, where we've had those samples. Yes, they've been tested, the cases.
Do you know where Lori Ann was going that night to see a friend or?
No.
she was actually dropped off to go to a party. Her boyfriend and her had a fight. He let her out of the vehicle, as I understood it. She was going to walk to a party. He went to the party, went back, and didn't find her.
Right. We last know that she was only a foot walking.
She was on good, and there's obviously nothing that we have that would show that Alan Wilmer Sr. came upon her as she was walking away from the Little Sioux.
No.
Also, can you explain the SACA grants and exactly how that figured in with the funding that made all of this possible?
So the
Is
sexual.
that accurate to say it made it all possible?
I wouldn't say possible. We had been, it's been very helpful. And let me first address SACA. So SACA is a sexual assault kit initiative. And it's a grant that was obtained through the Attorney General's office, Attorney General Miares' office. And so what SACA does for the Virginia State Police is it funds our violent crime analytical support team, some of our analyst positions. It also funds some of our testing that we do outside of the Department of Forensic Sciences. We test the lab used is DNA International Labs. And so we had previously to the grant, yes, we've tested with DNA International before, but this grant just helps fund that and bear those costs.
And are we tying Alan Wilmer Sr. into any other cases that are out there?
I'm not going to say yes. Yeah, we're not ruling anything out.
And that evidence has been sent away to this, is it the DNA International Labs, is that the name of the lab?
I can only speak to the cases within my division.
Right. Are any other cases that are hot right now that we're saying, hey, let's send this away and let's see if this is a hit from Alan Wilmer Sr.?
Not within my division.
Not.
We're not able to provide that level of detail, Andy. Just keep in mind that, you know, a close eye is being given to all of these cases. We are, it's not just the DNA evidence, but looking at just the activity of Wilmer, his behaviors, his patterns, etc. So a lot of cases are being looked at and investigated right now, but we cannot provide that.
Fair enough. Can you tell us what his behavior patterns were that you have already determined?
Well, I mean, just like Captain Bridle explained, earlier, he was always very near the water. He traveled the community quite a bit in various vehicles. It's looking at the proximity of some of these cases, in the general area.
Do we think that after the murder that Wilmer dumped Lorianne's body into the water at some?
That's speculate. We can't
know.
answer that.
So can you give us the confirmed number of victims by this person? Do we have that number so far, what that number is?
4.
It's 4.
It is 4.
Yes.
Now, and suspected, do we have a suspected number?
We do not.
No.
If he had lived, what would have been the charges that would have, I'm assuming, of course, first degree murder, among others, correct?
Yes.
And just for the record, there are 4 cases now, but there is nothing right now inside your jurisdiction dealing with Alan Wilmer Sr. or any other victims.
Nothing that can conclusively link Alan Wilmer.
Can you say how many cases has his DNA been compared to?
No, I cannot.
You don't have that, or?
I don't have that.
I know you didn't know Lorianne, but if there is anything that you could say about the historicalness of this and your role in this now in delivering this justice.
I think it's listening to the families, both David's family and Robin's family, and listening to the Comptons and Lorianne's sister. It's a sense of relief. It's just I'm just happy that there's some kind of resolution for them. I know it's not justice, but it is resolution.
Will you consider putting Brian Pettinger on the state police cold case side? He's on Suffolk now, but so many more people can see it if it's on the state police side.
I understand that, but inclusion on that site is not compulsory. So it's not mandatory. So that's something we will have a discussion with Suffolk about.
My question is more for you. I filed numerous FOIA requests for these cases that have been closed, and now this one's closed. And what I get is these cases are not closed. They're still open, and I can't get that.
We are actively investigating all unsolved cases. So,
But with this case and with Terry Howell, for example, you've said, look, this is who we're going to charge. So why are those cases not being opened up to the public, those case files that folks such as myself or the reporters can look at?
I personally wasn't involved in your FOIA request, but we can discuss after the conference. Yes.
2 things real quick. Have you been able to establish a timeline of movements of Wilmer Sr., and also, to the best of your knowledge, did he act alone?
So
In the cases, in the 4 cases.
So in the 4 cases, as far as a specific timeline, no. Did he act alone? That's an unknown.
Out of curiosity, how many new tips have you gotten since the last press conference around Wilmer's activities that might not involve him killing someone, but having encounters with him? Because I've seen a large number of those online, which I don't
I
trust.
don't have those numbers.
We don't have an exact number to share with you.
But are
Just
those
know
coming in?
tips are coming in, yes. And that's why we're asking for people to continue sharing information and providing those tips.
After the press conference, I guess it was like a year ago,
24 January.
So who came forward to suggest that we test for, that you guys test for Lorianne Powell's case? Was it the Gloucester Sheriff's Office, or?
Yeah, that's a good question. Can you give us the timeline of what happened in January of 2024 to Lorianne Powell?
I mean, there's so many cases. How did you know to link it up to test
what you need to appreciate is, and what I refer to it as the working group. So it's the agents and the analysts from the multiple agencies. Yes, the probability that he could possibly be involved drastically increased when that conclusive link was made, and so that's when it began.
So who suggested this case be tested?
That was born out of the working group. Can I tell you who specifically said, hey, let's test Wilmer's DNA against Lori Ann's? No, all I can tell you is that's something that came from our working group, our agents and analysts, and their investigative efforts.
State police
No, it's not state police. The FBI are involved with us step by step.
How, and at the time of January 2024, you were not even, Wilmer wasn't even on the radar for Lori Ann Powell. Is that fair? In January 2024?
We don't rule anything out, but as far as was it up there? No.
He wasn't a suspect until.
Right. And then how long after January 2024 did evidence be sent away to test for Lori Ann Powell?
I don't have that answer.
We can follow up with you on that.
Yeah, I think it's important.
I can tell you.
Yes, sir.
Is there any kind of a legislative fix, I might ask the attorney to, name specifically, attach a rider to a bill that would allow something like this?
To be entered into CODIS? Yes.
I've seen that at the federal level, just to name specific, this guy will do this.
Okay, we are going to stick with that and come back to it. We were also recording at the beginning of it to exactly nail down this 30-year-old case in which they are referring to and the suspect they are currently linking. We want to get that information to you. We do have a reporter who's in the room as well, been trying to get a hold of them to get more info. But right now we want to go to Illinois because we saw this. This is outside of that ICE facility in Broadview, Illinois. We've been following this location for weeks as we've seen protests and it being the center of a legal dispute as well, as there were legal challenges to the conditions of that particular ICE facility. Even just yesterday, there was a judge, a magistrate, that for 4 hours toured the facility after there were complaints that it was not suitable for the people who were being detained there. The administration, Trump administration and officials, they disagreed and said the people were being taken care of properly, including getting meals and those venues having enough space for those individuals as well who were inside. But this is outside of that same facility where that tour took place by that judge. We're still waiting to hear the official decision by that judge too. But again, these protests have been building, but right now you can see there are plenty of news crews there, protesters, but there is at this moment pushing what it appears by law enforcement, maybe the sheriff's department that is there in that Cook County area where they're trying, it looks like, using force to keep people at a certain distance. We're not quite sure what sparked this particular use of force at the moment, but you can see the tensions do appear to be rising a bit there outside of that ICE facility in Broadview, Illinois, which is not far from Chicago. Okay, so we know that these are sheriff's deputies based upon their clothing and what is on their back, which exact department, not quite sure at the moment, but these protesters clearly are being told and being forcibly moved to a certain area. They're trying to keep people there. I'm not quite sure exactly what sparked where we are at this moment, but we are seeing these people there. We just wanted to bring this to you as it happened live. We saw it happening while we were listening to that press conference, which again, we're still trying to get information exactly from the beginning of that presser that we just left in Virginia that was taking place in Suffolk, but we did want to make sure that we came to this here. Again, this is that same ICE facility where there's been plenty of attention for weeks now. And the backstory there in the Chicago area, like we told you earlier today, with the Border Patrol heading down to Charlotte. Well, they left from Chicago. Okay, Chicago for several weeks was the center of conversation when it comes to ICE involvement there in the area. You can see there's definitely a struggle that is going there with that man with his hands in the air and the sheriff's deputy at the moment, which, okay, looks like, again, they're forming a line there as protesters. But again, going back to it, we see there's that somebody who is currently being detained. Okay, someone's being detained and dragged away with their hands behind their back there at this moment. Again, this is in Broadview, Illinois. We had been covering the back and forth between leaders there in Illinois as well. As it appears, the kind of jostling there has burst of escalation, and then it kind of stops between certain of the deputies there. You can see it for yourself. I don't necessarily need to tell you that there, but we had back and forth, and when it comes to words, between the governor of Illinois, J.B. Pritzker, the mayor of Chicago, Brandon Johnson, and the president and members of his administration, when it comes to ICE involvement in the city of Chicago. The president has been very open in saying that he wanted more ICE involvement there, even at one point ordering in the National Guard to be in Illinois to assist and protect ICE agents and ICE officials there in Chicago. But the governor of Illinois and the mayor of Chicago, they have been very publicly and openly against the activity of ICE in their community, saying that it has escalated anxieties and has escalated tensions that they believe should not be at the moment, in which they say that they would argue their crime is going down. The president has said the opposite there about Chicago on multiple occasions. But again, a lot of this centering in on immigration, we know, when it comes to ICE activity in these communities, and many people in Chicago who represent the city and those activists. We held a press conference from educators just several weeks ago, maybe a month and a half ago. They have been pushing back against that type of involvement in their communities, saying that there are many people who have grown anxious and scared, right? As you see more people, it looks like that is the person that we saw there at that one moment that was going back and forth physically there with a sheriff's deputy. You can see now he has been detained and escorted away with his hands behind his back. And it looks like there are more either deputies or law enforcement there in the background that appear to have on some form of protection on them, and they seem to be coming to the area, I imagine, as reinforcement. You're looking at a live view here of protesters there in Illinois outside of that ICE facility. You can see just moments ago, tensions had been rising as every once in a while we've been seeing a back and forth of pushing between some of the sheriff's deputies there that you see and those protesters who are protesting just the presence of ICE there in the area. And choosing this location to shout their concerns and to show up en masse. Again, that location is the center of a legal dispute right now on whether or not the conditions are even good enough to hold people. And you can see people being taken out of that area. Plenty of news crews certainly have been capturing this too, documenting this moment. And this isn't the first time, actually, we've seen crews outside of this or people getting detained outside of this exact facility. I think it was just a couple of weeks ago, into the night even, that we saw people being pulled away from outside of this Broadview, Illinois location. So it has been a place where there have been plenty of moments of tensions between people who, in their words, are trying to voice their opposition to what the Trump administration says it is trying to do to clean up cities. And so we wanted to take you there. We'll keep it just for a little bit. I will say that we are monitoring to make sure there's nothing that's on any signs or anything of that nature that would be inappropriate for air. We have been watching that too. Just wanted to make sure on our end that we're covered. That's also the reason why we're not currently airing any audio, because we don't know what could potentially be said in the moment, and so we want to make sure that we try to keep it PG as best as we can with that also. So we'll keep this shot up just for a little bit. You can see some of the signs there, people saying resist, etc. More people kind of staying around taking pictures of the situation too. Looks like that crew has a good distance away from it. But again, protesters outside of that ICE facility in Broadview, Illinois, happening as we speak. All right, just give me a quick second. We're going to hold this shot up for a quick moment. I'm going to talk with our producers here just for a quick second. Just give me 30 seconds, and I'll be right back. All right, appreciate you guys giving me a quick second there. For those who are just coming on here on Live Impact News on 13 News Now Plus. Again, this is a live look outside of Broadview, Illinois, as tensions appear to be rising between protesters and sheriff's deputies outside of that facility. That, again, right now, we're waiting to hear the response from a judge that toured that facility, as there were complaints that it was not suitable for the people who being detained there. But that's just a portion of the story that I was just telling you. The tensions have been brewing there within that area of Illinois when it comes to ICE activity and protesters and city leaders and state officials. And we even know that we've seen video there in Chicago when it comes to pretty dangerous, I would say, car situations with people who at one point several weeks ago it was accused and referenced that there were people who had tried to corner in ICE officials there and attack them. The chief of police there in Chicago had received some flack. He was accused. They were accused, the department, of not protecting and helping with that situation. He then later gave a press conference saying that the facts of that matter were not represented correctly for his department. Again, you can see it here. Let's take that full there, Naya. You can see again, there appears to be at the moment, again, jostling back and forth between those sheriff's deputies and law enforcement and protesters. So we're monitoring that. We're going to come right back to it. We're getting some things situated on our end. We want to hit on before we head out just for the next few minutes or so on our forecast coming up, because we want to make sure that we do that. We're going to come back to this situation and talk about where the Border Patrol agents who were there, where they've now gone, and that is to Charlotte reportedly, and we're going to hear from city and state leaders out of the Charlotte area in just a bit of a press conference that they did earlier, so you can hear their concerns and their thoughts on that matter. But we do right now have meteorologist Hunter Forrest, who came in before he has to do the noon today. Hunter, I know this is one of those weekends we've been talking about. It's going to be really nice, which is great. Awesome. I think we deserve it after some of the days this week and how cold it is. But I do want to let you have a chance to tell people what they can expect as they're making their plans over the next few days.
Yeah, for sure. It's going to be a beautiful weekend. A good amount of sunshine today. We're going to see sunshine, or at least dry weather, heading into the weekend. Could see a few more clouds on Saturday compared to today. But it's going to be a great end to the work week, a beautiful Friday. and warmer heading into this weekend, and those rain chances staying low the next couple of days, but they'll uptick heading into next week, especially on Tuesday. But heading into Saturday, mid-60s to start off the weekend, so that's going to be feeling absolutely fantastic and comfortable waking up too in the upper 40s to right around 50, and even warmer waking up Sunday morning in the mid to upper 50s. So it'll be feeling extra nice to go for a nice stroll, especially Sunday morning. Highs will be in the lower 70s on Sunday. There's going to be a cold front that's going to be pushing through. So depending on what time that pushes through really is going to determine how high these temperatures go. If it pushes in a little bit earlier, temperatures may not get as warm, but if it pushes in a little bit later, we could be seeing temperatures warmer than the lower 70s. So we'll have to see, but overall going to be just a really nice weekend. And if you're doing a little bit of traveling, not bad. Mid to upper 60s to low 70s across the region. A good amount of sunshine on Saturday from DC to Richmond into Charlottesville and the Outer Banks. Outside right now, though, in our Thompson Creek Window Company sky view, beautiful blue skies here at the ocean front. Seeing a few people out there on the beach going for a little bit of a walk this afternoon or this morning. Right now we're in the upper 50s to right around 60 degrees, and that's pretty much where we'll stay throughout the day today. Some of us getting into the lower 60s, but right around here in Norfolk, likely the upper 50s. But you'll notice that sunshine sticking with us through this afternoon and into the evening, and then we'll see those temperatures dropping back into the upper 40s by this evening. So it is going to be a bit of a chilly one if you do have any Friday night plans. But satellite and radar is looking good out there. Not a whole lot to worry about. We have an area of high pressure just off to our south and west. So that's helping a lot of the area, and especially a lot of the eastern half of the U.S., staying nice and dry as we head into the end of the work week and into the weekend. We could take a look at the futurecast. You'll notice temperatures staying in the upper 50s to low 60s, and this evening staying dry, clear, and then heading into our Saturday morning, we're in the upper 40s to right around 50, so certainly not as cool as what it was this morning, and we'll get into the mid to upper 60s on Saturday. Could some of us even get into the lower 70s? Certainly. I mean, it's going to be a great day. I know the Norfolk State is playing tomorrow. Kickoff is at noon, so great weather for tailgating, great weather for the game. And if you have any plans after the game, if you're going out to celebrate, it's going to continue to stay really nice heading into Saturday evening. Even by 8, 9 o'clock, we're still in the lower 60s. And overnight, getting into Sunday morning, our winds continue to stay out of the south and west, which is pretty much a warm air. It helps us stay warmer through the day and especially at night, especially when we have cloud cover as well. So that's why we'll be waking up Saturday already in the mid to upper 50s, maybe even right around 60. So that's my type of morning weather, when it's already 60 degrees in the morning and you don't really have to bundle up that much. And then we'll get into the upper 60s to right around 70 on Sunday. You'll notice that wind shift. So we're warm, in the morning. Winds are still out of the south and west. And then you'll see in the top right-hand corner or top left-hand corner of the screen, the wind shifting more out of the north and west. So that's the cold front pushing through. So if it comes in earlier, temperatures may not get as warm because then it starts to bring in some of that cooler air. So we'll see temperatures kind of dropping throughout the day. But overall, still a nice day on Sunday, mostly clear skies and a bit breezy as well. And then as we get into Sunday evening, we're in the upper 40s to low 50s. And then we're back to the cool weather heading into our Monday morning, another morning with temperatures in the mid to upper 30s. And then we stay pretty cool all of next week in the upper 50s to right around 60. But we could see another uptick in temperatures by the end of next week into next weekend, back into the upper 60s. So we'll see about that. The models have been kind of flip-flopping the last couple of days. They've been trending warm and then cool and then warm. So we'll have to see how that kind of plays out. There hasn't been really a lot of confidence in those temperatures for next week. So we'll see. Hopefully they trend warmer. I'm on the warming side. But in terms of rainfall, Not expecting a whole lot over the next couple of days. Maybe an isolated shower on Sunday, but then we won't see our next big chance for showers until Tuesday. And even then, it's not going to be a washout. Just some isolated, scattered showers are possible. But I did want to show us the drought monitor as well. This was updated just yesterday. So things are looking pretty good in a lot of the region, a lot of Hampton roads. Just some abnormally dry conditions in the yellow. And then seeing a moderate drought around the Admiral Sound, Edenton, Elizabeth City, Ahoskie on the cusp of the moderate to abnormally dry conditions. So, a little bit of extra rain won't hurt, but, we don't really need a whole bunch of rain. Just a little bit of rain here and there to keep us out of this drought. But things are looking, pretty good for right now. So the rain coming on Tuesday certainly will be nice. But, over the next few days, plenty of sunshine, warming up, low 70s by Sunday. And then we drop back into the 50s by next week.
Here's what I need to know. Tomorrow morning, Hunter, I'm going to be emceeing an event on the Virginia Beach oceanfront for the American Heart Walk, right? So how should I dress? Do I need to wear a jacket, a coat? Can I go out there in long sleeves, short sleeves?
It starts at 10 o'clock?
We're going to be out there. I'll be there at 8, but 9 o'clock is when the actual kind of festivities start, and then 10 o'clock is when the walk starts, yes.
So you're 8 o'clock, low 50s. That's not bad, right?
Okay, yeah, I'll wear definitely a jacket.
A jacket. 10 o'clock, we're pushing 60, 10:30, 60 degrees. And then, by early afternoon, we're right around 70. So heavier jacket in the morning, light jacket when the walk starts, and then short sleeves when...
Okay, so I'll just be stripping basically throughout the process of the American Heart Walk.
I was about to say, realistically, who takes 2 jackets with them? You might just want to dress with layers, maybe like a long sleeve and then a jacket over it.
Okay,
good point.
I can do that. I should have asked Naya to begin with, to be honest with you, Hunter, so no disrespect.
Wow.
Absolutely.
No disrespect, even though the disrespect was...
You felt it.
It was high.
And then one more real quick, because we do want to get back to some of this breaking news that's happening. But tonight, we're having our Daybreaker meetup at the Norfolk Botanical Gardens. That starts at 5 o'clock until 6. If you haven't gotten your ticket yet, I do believe, at least before the stream, we still have that available on our website, 13newsnow.com, where I'll be there, Craig will be there, Ashley will be there. We love to meet up with our fellow viewers and Daybreakers there in the community for that. Again, at Norfolk Botanical Gardens. 5 o'clock tonight in Norfolk for those who are coming out. Last year it was freezing, not literally, but it was pretty cold. We thinking should be pretty decent tonight.
Yeah, this year is going to be really nice. We're going to see clear skies. It'll still be cool, but not bad. Mid-50s by about 5 o'clock.
Okay.
And then it'll drop quickly into the upper 40s by 7, 8 o'clock, but not bad for November. It could be, like you were saying, freezing like last year. So mid-50s, perfect. Light jacket, maybe a heavier jacket without the sun, but,
All right, man. Well, I appreciate it, Hunter. Thank you so much, my guy. I appreciate you coming in, and hopefully you have a good weekend, too, yourself. I know you got the noon to prepare for, but we definitely appreciate you stopping by and breaking that down, and good to have a pretty easy forecast for a change.
It's not bad.
It's not bad at all. All right, Hunter, we appreciate you. Okay.
Thanks, guys.
Right now, I do want to go back out to Broadview, but we're going to do something a little bit different here. I want you to see what's happening there in Illinois. So, again, the backdrop for this, you're looking at a live image there of protesters and what it appears to be sheriff's deputies there from Cook County there in Illinois. And you can see there are more that have come to this area since just the last few minutes before we had Hunter come in and give us a brief forecast. Now you have more of the armored law enforcement officials there from state police. It looks like they're there now to kind of help with crowd control. Those protesters are going against the ICE activity that has been going on not only in the Chicago area, but also what's been going on at that particular facility, because there have been complaints about conditions inside. Now, the significance of the day is really interesting because it was just yesterday where this week we've learned that the leader of the U.S. Border Patrol, Greg Provino, has now left Chicago. He was there for a minute back and forth. It's been roughly, I want to say 6 or 7 weeks, 8 weeks actually, since it was announced that the Border Patrol and ICE would be going into Chicago as what the Trump administration at one point titled Operation Midway Blitz there. Okay, so that's been about 8 weeks since that has taken place, and we've seen on multiple occasions U.S. Border Patrol Commander Greg Bovino being there in this particular area at that particular facility. Well, now they have moved. Now he has moved, and it is now being reported by local outlets in Charlotte, North Carolina, that the U.S. Border Patrol is going to be going there as a part of its immigration crackdown. And then earlier today, we heard from multiple officials in the Charlotte area who are speaking out against this, who say that they do not want U.S. Border Patrol agents and what they have seen in Chicago to come down there. So this is what I would like to do if we can. We're going to run the press conference, but if we can at the same time keep open also the live shot of what's going up there in Illinois, just so we can watch it while we listen to a previously recorded presser just earlier this morning by these officials in Charlotte, North Carolina.
Member, Representative Aisha Dew. I just forgot my name. But thank you so much for joining us. We're all gathered here from many branches of government, from obviously our state legislature, our school board, our county commission, our city council members, because we do not want ICE here. We do not need to have Border Patrol. As I've already said, I'm not quite sure what border we're patrolling here. Are we patrolling Rock Hill or South Carolina? We don't have borders here in North Carolina that need to be protected. We don't need to be protected from Virginia, Tennessee, nor South Carolina. And I'm sorry, but people are not joining us in Wilmington. So there's absolutely no reason for us to have ICE, to have Border Patrol here. This is a safe city. Our crime rates have gone down since the previous year. This is just another something out of the playbook. When you look at Washington, D.C., the National Guard was picking up litter. So if they want people here to help us pick up litter, I think we've got that covered as well. We don't need people here to help us clean up our city. We can take care of our city. We can take care of our own. In 2016, when there were protests, we had a Democratic governor, imagine that, and a Democratic mayor. And when they thought that things were too much, they actually called in the National Guard. No one here is called in the National Guard. No one here is called in Border Patrol. We know how to take care of our city. We know how to protect our city, and we simply do not need them here. So next up, we will hear from Representative Jordan Lopez.
Well, thank you, everybody. Good morning. In the interest of brevity, I will try to keep my remarks short. First, thank you to every one of you for being here this morning. Thank you to my colleagues across our local government for being here this morning. For my constituents, for all of our constituents, I just want to say that we see you, we are standing with you, we are here for you. Over the past several days, I've had conversations with community members, with leaders, with neighbors, and each time we talk about this expected enforcement operation from the federal government, and I'm speaking to people across all races, across all backgrounds, across legal statuses, and the common denominator is fear and concern. We've seen what has taken place in other cities across this country when the federal government gets involved. We have seen the undisciplined agents pointing weapons at unarmed civilians, the indiscriminate rounding up of civilians who are sleeping in their homes in the middle of their night in Chicago. We have seen the worst of law enforcement. And as a lawmaker myself, I know laws must be enforced, but the how matters. And whenever you decide that creating the perception of peace through fear tactics, through militarized agents walking down the street, that doesn't feel like a safe or a welcoming community to me. That feels like a prison. And that is not what the people of House District 112 are asking for. That is not what the people of the city of Charlotte are asking for, or the people across Mecklenburg County. We do not want that here. So I stand with our local law enforcement leaders, our executive leaders like Mayor Lyles, who have asked for greater communication from the federal government, because the interest of all of us, I believe, is the safety of our constituents, is the safety of our city, and we want to make sure that everybody knows we are standing with them, and we also want safe cities, but we want to make sure we do it in the right way. So thank each and every one of you all for being here again, and I believe I will be passing this off next to back to Representative Dew. Appreciate you all.
Thank you. We have so many people here to speak. I'm actually going to go to one of our community members who actually came up from Charleston without having to go through Border Patrol, who is representing SEIU.
Good morning, my brothers and sisters. It's a good morning to be here on this chilly morning, but it's an exciting morning to be here. Travel from Charleston. My name is Niecy Brown. I am the union representative for the North Carolina area. I represent the workers here in North Carolina, and I came to stand in solidarity with our politicians, our community leaders, our working families, our children, the entire Charlotte community. I actually want to say that I'm a union leader that believe in making it clear that our priority is to protect our workers, no matter who they are, no matter the color of their skin. It doesn't matter where they came from. Our priority is to protect our workers. Deploying U.S. Custom and Border Control here in Charlotte does not make sense. I'm with you, sister. In our city is an attack on our community, our workers, and our First Amendment. The deployment is a pattern from the administration that target Democratic-led city, especially those led by black leaders who choose to welcome all of God's children. I don't know about you, but Charlotte is a Bible city, and we believe that we love everybody. All of us are God's children. So no workers should feel fair being in the city of Charlotte, being detained, assaulted, taken by federal agents simply for showing up for work. Amen. We don't need immigration and custom enforcement coming into Charlotte, disrupting our city, creating fear in our city and workplace, trying to divide our community and to make Charlotte a less safe place. What Charlotte needs, we need work, we need affordable housing, affordable health care, wages that we can live off, being able to go to the grocery store and not spend our entire check. That's what we need in Charlotte. Our community thrives on standing and sharing our values of freedom, opportunity, and dignity for everyone. But one thing I read, because I'm a Bible girl, I read in Psalms 29:2, and it says that whenever there is a good leader, the people rejoice. But whenever there's a wicked leader, the people groan. And I don't know about you, but we're at that point that we're groaning now because who is in leadership? There has to be something done. So immigrant workers enrich our community, help drive our nation forward. They support our family, contribute to everyday work in the city, and deserve to be safe in their workplace and their home. Let me be clear. We will not be divided by immigration status, by fear. We're going to stand together with our neighbors, with our sisters and our brothers, because I do believe that when we fight together, when we stand together, we will win this fight. Thank you.
Thank you. Next, we will have Senator Caleb Tedros.
Thank you. Hello, everyone. My name is Caleb Tedros. I represent some of you all in the state Senate. We're in my district right now. The past week have shown us, what a way to govern, where we have had community members, elected officials, even reporters on these fact-finding missions just to find out whether a federal force is coming into the city of Charlotte. The number one word you're all going to hear in the next few months when it's time to campaign is going to be transparency. What part of this governing has been transparent? What part of this entire process has been fully shown so that community members know what's going on. And I understand what these community members are going through. Myself, I'm from an immigrant family. My family is originally from East Africa. So outside of dealing with the constant plight in this country of an affordability crisis, outside of the anxiety of not having somewhere where you can afford to live, you now have to have an anxiety about a federal force coming into Charlotte and you not knowing what they're going to do, you not knowing what's going to take place. The only thing you have to go off of is Twitter announcements and rumors about what's going to happen in Charlotte. That is not an effective way to govern. It doesn't take a president to know that. Excuse me. And we've seen that here even at the local level. A North Carolina State Senate and House of Representatives where we still don't have a budget. The only state in the United States of America with no budget. And of course, to take attention away from this, you have authoritarian, you have sort of these political fiascos to take attention away from that. The fact that we don't have a budget, the fact that people's health care is doubling and tripling. So what do? You have fiascos like this. You have political theater, and you have constant and new anxiety you're introducing to the public. Folks in Charlotte are not going to be made safe by this. What if you care about actual safety, you care about fully funding our police officers, you care about additional money spent on mental health resources, you care about additional resources for our public safety programs. That's how you push back against public safety. That's how you help folks. You pass a budget, you help folks with health care. You don't rely on sort of fear tactics and lack of information to hit folks at the local level. And that's what you see folks are fighting against. It's the lack of transparency, the lack of everything you all are going to hear on the campaign trail in the next few months when these people come out and talk about the great job or their lack of. And so I want to thank you all. I want to thank the speakers here and community members. I mean, it takes a lot of courage to come out here and speak your truth. And that's something that the city of Charlotte and the state of North Carolina is going to continue to do. Thank you.
Thank you. Next, we will have Cameron Pruitt, who is with us from the Freedom Center for Social Justice.
Thank you. Good morning. Thank you all for being here. You know, we are 14 days into the month of November, 2 weeks from Thanksgiving, and folks still don't have their SNAP benefits. We are sitting in a city where people are planning and trying to gather together to put a turkey on the table, to bring their family members, asking them to come home and travel and be with them. But now this weekend, we have to worry if families are going to be separated and torn apart. And so as a Christian, I pray that everyone looks into their hearts and asks, what would you do if this was your family? What steps would you take? What would you donate? What would you volunteer? How loud would you yell in the streets? And so I'm asking you to do that, to stand with the Carolina Migrant Network, to shop at immigrant-owned businesses. Charlotte East has a full list. And to peacefully and prayerfully and with moral clarity take action in this moment. You have heard from speakers, this will not make our people safe. This is not a targeted action. We have seen Border Patrol use helicopters on civilian buildings and not apologize. This is not about legal status. This is about the color of someone's skin, about where they come from, and about causing fear and division. So I ask everyone, take action, stand together, take action, stand together, pray, and we will get through this. Thank you.
Next, we will have Jonelle Coswell, who was a part of the chair for the International Cabinet, also worked with International House, and is also an immigrant herself.
Thank you, Representative Dew. I don't know, maybe this isn't working. Hello, everybody, and good morning. This is a very, very dire time that we're gathering here today. I'm a proud immigrant, I'm a proud Jamaican American, and I have been a part of this community for over a decade. The immigrant community in Charlotte is vibrant, productive, and contributes over $1 billion of spending revenue each year to this community. Immigrants not only bring their culture and diversity, but we help to make this community prosperous and a healthy economic ecosystem. I have recently been grieving the loss of a very, very dear friend. And I can only imagine that this kind of grief, this kind of sorrow is only, I can't even describe what families must go through when they come home.
Okay, just wanted to real quick allow you to understand what we're taking right now. You're listening to a recorded press conference from just over an hour ago out of Charlotte, North Carolina, where officials there are pushing back against reports that Border Patrol agents are on their way to their city. Meanwhile, at the top there, that is a live look at the ICE facility in Broadview, Illinois, in which Border Patrol agents just left. But you can see there are protesters outside, and now there is a heavy state police and sheriff deputy presence there trying to keep the peace there in that particular situation. We've seen multiple people detained, taken away with their hands behind their back just within the last 30 minutes. But we wanted to show these two side by side, that live image there in Illinois and this recorded presser there in Charlotte, because the comments that they are making are in part connected with the activity that they believe will bring some form of intensified tensions there into their city. So I just want to kind of give a background on how these two are potentially connected when we're talking about this particular conversation. So I'll let you go back to listening to what they had to say, and we'll come back in a bit.
The kind that makes you hold your breath when somebody knocks the door, and the kind that parents feel when they just hope to come back home to their children at night. That fear is not distant to me. It's a part of who I am. I grew up undocumented in Charlotte, in the neighborhoods that so many immigrant families call home. And today I stand before you as not only the first Latino, but the first formerly undocumented member of the City Council. Yesterday, the Sheriff's Office confirmed that CBP will be in our city. However, no transparency, no accountability, no explanation, not to my colleagues behind me, not to the public, not to the families who deserve to know what's happening in their own city. Let me say this clearly. This is not about public safety. It is not about finding criminals. It is about fear, it is about quotas, and it's about control. When federal agents enter our communities without warning, without cause, and without humanity, they are not keeping us safe. They are terrorizing our neighborhoods, and we do not welcome our communities being terrorized and attacked. Our Queen City will not become a staging ground for fear. Amen. We will not confuse cruelty with safety, and we will not allow the politics of intimidation to define who belongs here. We saw this before in Chicago, where federal actions left families broken and trust shattered. And we will not allow Charlotte to follow that same path. CBP is not the same as ICE, but both agencies have operated without transparency, without oversight, and too often without humanity. Let's be clear. The CMPD is not participating, has not been asked to assist, and has no authority to intervene. But that does not mean we are powerless. We must act. We must use every tool within our moral and civic power to protect our residents, and we must make it clear that no city property, no local resources, and no taxpayer dollars will ever be used to help carry out these operations that terrorize our people. Charlotte's immigrant story is a global one, from Colombia and Mexico, to the Congo and Ethiopia, to Vietnam and Nepal, to Ukraine and Albania. When you attack one of us, you attack all of us. When you criminalize migration, you criminalize humanity. We must lead with courage, we must move with urgency, and we must protect every person who calls this city home. We will not wait for permission to do what's right. We will not stay silent while fear spreads, and we will not let federal agencies decide who belongs in our city. And to our immigrant neighbors, you are not alone. You are seen, you are valued, and you belong here. Charlotte's strength has never come from fear. It has come from faith in one another, from the courage of those who built this city with their hands, and from the love that binds us together. We do not welcome terror. We do not consent to cruelty. And we will not let fear define who we are, not in Charlotte, not in our Queen City, not on our watch. Buenos días. Esto es personal. Yo sé lo que se siente el miedo. Ese miedo que se siente en los huesos. El que te hace contener la respiración cuando tocan la puerta. El que no deja dormir a los padres temiendo no regresar a la casa al final del día. Ese miedo no es ajeno.
Okay, we're coming out of that right now because we want to go to the other big news that came out of Virginia. Our crews there in Suffolk today as investigators unveiled a link to a 30-plus-year-old murder cold case, all right? And so what we have now learned is that state police have now linked a Virginia man to a fourth unsolved murder from more than 3 decades ago. We are talking about the 1988 death of Lori Ann Powell, and this is the information that we have just gotten confirmed within the newsroom here, is that today Virginia State Police and Isle of Wight Commonwealth's attorney announced that through the advancements of DNA technology, investigators have identified Alan Wilmer Sr. as the person responsible for the death of then, I believe she was 19 years old in 1988, Lori Ann Powell. Okay, so we have a press conference that is pulled up right now. This happened just hours ago, just wrapped up within the last 30 minutes. Powell last seen alive March 8th, 1988. She was walking along Route 614 towards Route 17 in Gloucester County. Her body was later discovered on April 2nd of that year, about a month or so later, in the Elizabeth River near Craney Island, and Powell had been stabbed multiple times. She was 18 years old at that time. Now, before we get into this, the name Wilmer may be familiar to you because we had reported previously, not too long ago actually, that he was connected to other murders that were referred to as the Colonial Parkway murders. Also connected to the deaths of 14-year-old Robin Edwards, 20-year-old David Knobling, both of those in 1987, and Terry Howell in 1989. DNA evidence is a big part of what took place here to get this link confirmed. Let's go ahead and send it back to that press conference that took place again just about an hour ago in Suffolk, where they unveiled these newest findings.
Everyone who is here in person and also joining us via live stream. My name is Robin Lawson. I am the Public Relations Director for the Virginia State Police. We are especially grateful today to have our partners at the FBI and Hampton Police Department joining us today as well. The press conference today will consist of several speakers, and then we will open the floor to questions. So I ask the media to please hold their questions until then. On behalf of the Virginia State Police Bureau of Criminal Investigation, Chesapeake Field Office, and the Isle of Wight County Commonwealth's Attorney, we are here to announce that a suspect has been identified in the 1988 cold case of Gloucester County teen Lori Ann Powell. Through advanced forensic evidence analyzed and certified by DNA Labs International, located in Deerfield, Florida, Alan Wade Wilmer, Sr., has been declared the person responsible for Powell's homicide. As a result of the forensic findings, the Isle of Wight Commonwealth's Attorney confirms that if Alan Wilmer Sr. was alive today, he would be charged for Powell's homicide. To the victim's family, Mr. and Mrs. Compton, and the Kirchner family, we express our sincere condolences for your loss and the pain you have experienced these past 37 years. Thank you for your cooperation and understanding as our agencies worked toward solving this case. Wilmer Sr. died in December 2017 at the age of 63 at his residence in Lancaster County, Virginia. Powell was last seen alive on March 8, 1988, walking along Route 614 towards Route 17 in Gloucester County, Virginia. Tragically, her body was discovered on April 2, 1988, in the Elizabeth River near Craney Island. Powell had been stabbed multiple times. She was just 18 years old. The break in Powell's case came through the hard work of agents assigned to the Virginia State Police Bureau of Criminal Investigation, Chesapeake and Richmond field offices, and analysts assigned to the Homeland Security Division's Violent Crime Analytical Support Team, also known as VCAST. Additional support for this investigation was provided by the Virginia Office of the Attorney General, Jason Miyares, who funded analytical support and testing via the Virginia Sexual Assault Kit Initiative, also known as SAKI. Many in this region will recall in January 2024, it was determined that if not for Wilmer's death, charges would have also been filed against him in connection with 3 other murders: David Knobling and Robin Edwards in Isle of Wight in 1987, and Teresa Lynn Spall Howe in Hampton in 1989. Knobling and Edwards' deaths occurred during a series of double murders collectively known as the Colonial Parkway murders. We are still seeking the public's help through our continued efforts to seek justice for the victims of these and other unsolved crimes. Today's announcement also does not conclude our agency's investigative efforts to determine if Alan Wilmer Sr. was responsible for additional crimes. While primarily led by the Virginia State Police Bureau of Investigation Chesapeake Field Office, the Lori Ann Powell homicide cold case investigation has been part of continuing collaborative efforts between VSP, FBI, and the Hampton Police Department. I would now like to call forward Captain Timothy Rival, Commander of the Bureau of Criminal Investigation Chesapeake Field Office, to share details about this case.
Thanks, Robin. Good morning and welcome. And a special welcome to Lori Ann's family. Her mother, Joanne Compton, her stepdad, John, who raised Lori Ann, her sister, Cindy, her husband, John, and their daughter, Mackenzie. Thank you for being here with us today. The resolution of Lori Ann's homicide case was the direct result of persistent and collaborative investigative efforts taken by multiple agencies. That enabled the Virginia Division of Forensic Sciences to collectively link Alan Wilmer Sr. to David Knobling and Robert Edwards, as well as Teresa Howe's deaths, and then ultimately to link Wilmer Sr. to Lori Ann's death. You may recall Wilmer Sr. had no felonies on his criminal record, so his DNA had never been obtained until it was necessary for identification purposes after his death. Interagency cooperation to include the sharing of Wilmer Sr.'s genetic profile was crucial in helping us achieve these long-awaited results. We recognize this announcement has been a long time coming, especially for Lori Ann's family. While we hope this provides a sense of resolution to the family, we recognize there are other families of homicide victims who are still hoping for answers. That's why we continue to push forward with our investigations. We are not ruling anything out when we examine other cases and pursue new ones. Our agencies collectively are still seeking to work to reconstruct Wilmer Sr.'s movements and encounters, Again, we're asking for the public's help in doing this. In the press package, or the press release, there's background information regarding Wilmer Sr. I just want to take a few minutes and go over that information. Wilmer Sr., who went by the nickname Pokey, was 5'5", muscular, and weighed approximately 165 pounds. He had sandy brown hair, blue eyes, and would sport a close-cropped beard. Wilmer drove a distinctive blue 1966 Dodge Fargo pickup truck with a Virginia license plate EMRAW, raw, and typically had clamming equipment and a large affixed metal toolbox in the bed. This was just one of several pickup trucks that Wilmer Sr. drove during the 1980s and early 90s. Wilmer Sr. also had a small commercial fishing boat named the Denny Wade. It was a 1976 custom-built wooden boat. He often lived on it during this period, and he would dock in marinas in Gloucester and Middlesex, as well as Northern Neck and Hampton Roads. His trade during the 80s was a fisherman, mainly clams and oysters, and he also ran his own tree service called Better Tree Services. He was an avid hunter, and he belonged to at least one local hunt club in the region. Again, we are asking for the public's help. Any tip could be useful in solving other cold cases. We will go where the evidence takes us. We can't do it alone. We need your help. What Lori Ann's case and other resolved cold cases demonstrates is that our agents and analysts, along with our local and federal partners who are here with us today, continually and diligently investigate to seek justice and/or resolution for the victims and their families. And I'd be remiss if I didn't recognize some folks, and I'm sorry I didn't do it in the beginning. We have with us today Mr. Mike Peasley, Crim ASAC with FBI, Federal Bureau of Investigations. We have our Commonwealth Attorney from the Isle of Wight, Ms. Georgette Phillips. That's all I have. Thank you.
Thank you, Captain Ribel. Today, we would like to spend time focusing on Lori Ann Powell, remembering her for the intelligent, beautiful, and talented young woman that she was, and the positive impact she had on so many others. I would now like to turn the podium over to Lori Ann's sister, Cindy Kirchner.
Good morning. After 37 years of heartbreak and unanswered questions, our family has finally received the long-awaited news that the murder of our beloved daughter, sister, Lori Ann, has been solved. We are profoundly grateful to the dedicated law enforcement professionals, investigators, forensic teams, and community members who never gave up on finding justice for Lori Ann. Their tireless efforts, advanced technology, and unwavering commitment brought us the answers we have prayed for. While nothing can erase the pain of losing Lori Ann, today we find comfort in knowing that the truth has come to light and that accountability has finally been achieved. We hope this resolution brings a measure of peace to everyone who loved her and all the families still waiting for justice in unsolved cases. Thank you for letting me make that statement, but I want to talk a little bit about my sister. Lori Ann lived her life. She was a young woman trying to find her way. navigating the world, making choices, learning, growing, chasing her dreams, and trying to build her future like anyone else her age. She had the fearless energy, the kind that drew people in and reminded them to appreciate every day. She didn't wait for life to happen, she made it happen. She was bold, brave, spontaneous, full of life, witty, smart, and beautifully herself, a true firecracker. She spoke her mind, followed her heart, and never apologized for being herself. She wasn't afraid to take chances or make mistakes. She believed in living every moment as if it mattered, because to her it did. She was a remarkable human being. Her laughter was contagious, her energy unforgettable, and her courage inspiring. She taught us what it means to be fully, not with caution, but with courage and joy. Live fully. She deserved so much more time here, but being her sister for 18 years was a privilege. I will always be grateful that she was my sister.
Okay, you were just listening